Hi there. This is the Pennsylvania Clinical Network podcast, where we feature our network's talent, resources, and the positive outcomes they yield every day at the PA Clinical Network. I'm Dr. John Pagan, Chair and CEO of the PACN, and your host. It's my pleasure to welcome Dr. James Galasso of Galasso Family Practice, who is a partner in the PA Clinical Network and also one of our committee members. Welcome to the show, Dr. Galasso.
Thank you and good morning.
I think first it'd be helpful that our viewers learn a little bit about yourself. What is the story of Dr. Galasso? How did you end up in Swoyersville, Pennsylvania? And what inspired you to even get into medicine?
It's very interesting. Actually, what inspired me to get into medicine, my father was actually a pharmaceutical rep with Pfizer when I was growing up. And when I was younger, he also was a volunteer for our local ambulance association here in Swoyersville, where I grew up. And as I grew up, I became an EMT and actually a paramedic. I was became president of the local ambulance association here. And working as a paramedic, I would go to the emergency room to see the different physicians, and it really interested me. And I said, someday I'd like to be a doctor. And I was actually going to try to be an emergency room physician. But one of the emergency room doctors over my career in training said, "How old do you think I am?" And I said, "Oh, probably your mid-30s. He goes, "Oh, I'm the oldest guy in the department." He said, "Go into primary care and learn how to do ER." And that's what I did. I went into primary care, did my training, and I came back to my hometown where I practice. I'm actually 3 blocks away from where I grew up.
So that's very, very neat. And obviously now you practice, you and your family and your practice are part of that community. Can you elaborate a little bit more about how, about the community of Swoyersville and how your practice interacts and is a part of that?
Sure. Swoyersville is it's a blue collar town. We have a high Medicare population with a lot of older patients, but I take care of babies all the way until they're geriatrics. I mean, we have the whole 9 yards. When I first started practicing, I actually used to do OB, but things changed, and we also went to the hospital, all the nursing homes. And it's a nice little community, with close-knit families. Everybody knows everybody. It's a population of probably about 2,500. It's the type of place we're in.
That's neat. And actually your dedication to your community and your patients, shines through in your choices. I guess there's no better testament than, you sinking down your roots and doing that. I've had the pleasure to come out to your office, and again, a lovely office in the middle of the community, and you're there as a resource for them, which is wonderful. What are some of the factors that enticed you to join the PA Clinical Network? And I'm sure some of the things that may play into that are the challenges of independent practice these days.
That's correct. The local hospitals here, we have the Geisinger system, and we have Commonwealth Health, which is CHS out of Tennessee. So they're big corporations. So there's a lot of challenges with dealing with 2 big corporations, and they really don't care much about independent doctors, even though they say they do. We were involved with a network that the hospital had, and it just wasn't going anywhere. And I met Keith Taylor, and he approached me and mentioned about the PA Clinical Network and would I be interested. And I signed up, and it was probably one of the best things that I did in private practice because of all the resources that were available. Just the malpractice, we have group malpractice, it's cheaper. I'm able to get supplies cheaper as a group. Even the behind the scenes help the network is doing with us with the with our CIN, just the background work that doesn't cost me anything, that you've been supporting us. So that was the main reason I was able to get in and to be able to stay into private practice.
Yeah, no, and it's a common story, and you touched on so many things, and that the clinical network does do behind the scenes, and we'll get into a little bit more about that. And you did mention one of the members of our team there, Keith Taylor, who is our senior director for business development, and was very instrumental in the early recruiting phases there. Now, Keith also, in addition to looking for good fits and good practices for the network, Keith also helps us with those support mechanisms and finding good fits with other vendors to help the lift of your everyday care and your practices, and make sure that you get credit for the good care that you give every day to all your practices. Could you tell us a little bit more? I guess, again, you've made some pretty significant life choices to be an independent practice, to be where you're located there. Why do you think it is important to maintain independent practice? You did allude to some of the larger mega mergers and health industries around you. What's so valuable to you as a physician, as well as to your patients, to maintain that independent practice, rather than you just becoming, one of the many other employees of other those large institutions?
The big thing is continuity of care. Most of my patients, I've been doing this for 30 years now. The majority of my patients I've been taking care of for 25 plus years. So I'm taking care of grandparents, their children, their grandchildren. So I know family histories, and I know these people like they're friends. And they get me all the time. Now, my wife is also in the practice. She's a physician's assistant that joined us. So they get either one of us. So when I hear somebody's name, I already know who they are. Now that we don't go to the hospitals can call me and say, "Hey, Jim, can you tell me about Mr. So-and-so?" And I could read it right off of my head. I could say, you have this problem, this problem, this problem, this, watch out for this, watch out for that. So you're going to get that one-on-one with us. You're going to get the same person every time you come to my office. We're in a corporation, it's who's available, and they have a revolving door. So a lot of the patients that transferred to us over the years, that was one of their big complaints with the bigger systems, is I never get to see the same doctor. I always see an extender, or they don't know my name. They don't know my problems. I know everybody's first names. I know when they come in, I talk about their families. We know the whole history of them. So we treat the whole family, the whole person, and that's what you're going to get here in a private practice. And that's why we need to keep independent small practices there. I think you get a better feel for your patients, and the patients do get better quality.
Sure. And I think one of the things you mentioned too, and one of the goals of the Pennsylvania Medical Society, which had the dream or the vision for the PA Clinical Network there, is to maintain that choice.
Yes.
Patients continue to have that choice to see it, and physicians to continue to have the choice too, to practice in the setting that they think is ideal for their unique community, be it in Schweyersville or anyplace else, to do that. So that choice is so critical. And I also recognize, in the bigger picture, that choice is so important to even the employed physicians. So the employed physicians, when it comes time for their next round of contracts, if there's no choice to go out to independent practice, if there's no healthy independent practice environment, well, they're kind of stuck with the contractual terms, for better or for worse, within that institution. And again, if it's a monopoly, they don't have much choice. I think you and I even talked about sometimes the non-compete restrictions that these institutions have end up harming patient care, because if you leave employment, they make you leave the area.
Correct. And that's interesting. It reminds me of also, I was independent when I came out of residency, and there was a group of independent physicians. It was a big group with open walls. We had some specialists. It was called Intermountain Medical Group. And I joined Intermountain Medical Group because we were all independent to purchase things together and to lower our costs. And I became a board member with them, and that's how I got involved with the governor's chronic care initiative. But unfortunately, the group was then bought out by Commonwealth Health, which was the company out of Tennessee. And I was employed for 5 years. So I saw what it was like to be an employed physician. And I felt the restrictions of what I wanted to do for my patients. They pretty much would dictate and say, nope, you can't do this, you have to do this. You're only allowed this much time with your patient. My patients know when they have an appointment, whether it takes 5 minutes or a half hour, they're going to get it. And the next person knows I might have to wait a little bit. I'm going to get the same time, even if I'm behind. I don't have a clock on my computer saying, oh, 15 minutes is up. I have to go to the next room, make another appointment. And that's what's happening now with a lot of the employed physicians. And that's what I hear at meetings, that they're restricting them to time frames, and they have to see a certain number of patients. And that's why the independent practice, you can do what you need to do. And I went back into private practice, and I had to work around a no compete clause. And I was able to actually get out of that contract and come back into the same practice that I was in. So it's still available. It's still out there. So anybody who's listening that's employed, it's still here.
Sure, and that is one of the fundamental missions of the PA Clinical Network, is that the independent practice can not only survive, but can thrive,
Correct.
with an attention to quality and using the data that's behind it. I know we can go on probably forever and keep talking
Sure.
about, the valuable benefits that your practice has for your community. But we're kind of out of time for today's show. But we will keep everybody with a cliffhanger that we have part 2 with Dr. Galasso coming up, and we'll talk a little bit more about those quality efforts, especially globally in terms of your governor's initiative as well as our ACO. But that wraps up our conversation for today's show. I'm Dr. John Pagan, CEO of the PACN and your host. Thank you for tuning into the latest installment of the Pennsylvania Clinical Network podcast. And be sure to look for the other interesting part of this podcast series with Dr. Galasso shortly.
Thank you very much, and I'm looking forward to it.